Hello, I'm Dr. Bill Wagoner. Welcome to today's Tuesday Tip. Today, I'd like to tell you about a recently published meta-analysis that looked at the success of light-cured calcium silicate-based cements as pulpal therapeutic agents. This article compared the light-cured calcium silicate cements to calcium hydroxide, MTA, and biodentine. The article was published in Clinical Dentistry in February of 2023. This systematic review and meta-analysis looked at the success of light-cured calcium silicate cements as both direct and indirect pulp capping agents. 10 studies were found that were included in the meta-analysis. These studies evaluated performance from a 1-month follow-up to a maximum of 36 months. The analysis found that for direct pulp capping, light-cured calcium silicate cements were comparable to MTA, calcium hydroxide, and biodentine at 6 months, but by 12 months, everything performed better than the light-cured calcium silicate cements. However, for indirect pulp capping at 6 and 24-month follow-up, there were no differences in any of the 4 materials. The authors concluded that light-cured calcium silicate cements should not be used for direct pulp caps. However, MTA, biodentine, calcium hydroxide, and the light-cured calcium silicates all perform equally well for indirect pulp therapy. For several years, we've known that direct placement of resin-containing materials onto pulpal tissues can be an irritant at best and toxic at worst. So this undoubtedly explains why the light-cured calcium silicate materials did not perform well for direct pulp capping procedures. NuSmile's recently introduced NeoLiner LC, which is a light-cured calcium silicate cement. Its physical properties surpass those of other light-cured calcium silicate cements, and it has excellent handling characteristics. NeoLiner LC is recommended for indirect pulp capping procedures in both permanent and primary teeth, but like other light-cured materials, it is contraindicated for direct pulp caps or pulpotomy procedures. NuSmile's NeoPutty or NeoMTA2 are the preferred choices for direct placement of a material onto pulpal tissues. I hope you'll have a chance to try a syringe of NeoLiner LC. I'm sure you'll find it an excellent addition to your pulpal therapeutic armamentarium. Well, thanks for listening. I'll see you next time.